Hi, my name is Dr. Amir. Due to the major changes in our life from COVID-19, I want to give you an update. Since my last video in mid-February, the outbreak was declared a pandemic. It took 3 months for the number of infected patients to reach 100,000. After that, it only took 12 days to reach 200,000. And since then, it has reached over 500,000. Due to the domino effect and the genetic changes of the virus, which became more contagious. So unfortunately, yes, the situation is very serious. But panic and fear will not help you fight this virus. What will contain the virus is enforcing strict isolation and protective measures, like in China. A major reason for this fear is the massive spread of messages on the social media. Some of them are true, others are false, and some we don't have an answer to yet. So please, stop forwarding messages and videos. It is very confusing and scary to the public. Please rely on your source of information from a trusted site, like your local health department, WHO, or the CDC. One of the most asked questions is about treatment and possible vaccine. There is good news. Some countries are using experimental medication which are showing some promising results. Examples are medication for malaria, Ebola, HIV disease, or Japanese flu. Unfortunately, a lot of people are buying and stocking up on malaria medication in fear. And it has led to overdose in some patients. This medication should only be taken if needed under medical supervision. As for the vaccines, several organizations are currently working on developing them, but it might take several months before it's ready. So your focus at this time should be on how to prevent catching and spreading the virus. A patient asked, does the heat kill the virus? And will it be over by the summer? A lot of people are using hair dryer, trying to kill the virus on objects, or even in their nose. This is false. We really don't know the exact answer, but from evidence so far, the virus can be transmitted in all areas, even in hot and humid weather, like in Australia now. An important question is, what shall I do if I have a fever? First, please don't panic. A fever is when the temperature is above 38 degrees Celsius or 100 degrees Fahrenheit. And in order not to overwhelm hospitals, please treat it at home, as you normally would with a regular flu, by taking over-the-counter medication and trying to isolate yourself from your family. Now, if you don't feel better in few days, then consult your doctor over the phone. In some countries, for mild corona cases, you might be asked to be self-quarantined at home, like the British Prime Minister. And most of the time, it will get resolved on its own. Remember, over 80% of COVID-19 cases are mild, and only 15% might develop pneumonia. So if you get short of breath or have difficulty breathing, then call the ambulance. Another question, can I take ibuprofen for my fever? This statement was all over the media because of one patient got worse after taking it for his fever. So far, both the WHO and the CDC did not put a warning against taking ibuprofen, so patients can take it to treat fever. I have also been asked a lot if food delivery is safe. Yes, it is safe to order food. Normally, the virus cannot be transmitted by food because it can get killed by the acid in the stomach. But try to avoid the close contact to the delivery person or ask the order to be dropped at the door. Another question, how can I increase my immunity? According to Harvard Medical School, good immunity comes from eating healthy, regular exercise, and sleeping 8 hours a day. You should also avoid smoking and excess alcohol. Of course, don't forget to take zinc and vitamin C, which is found in lemon, orange, or kiwi. The next and most important question, how can we avoid catching the virus? Simply stay at home. This is your safest place. And please be positive about it and consider it as a good time to bond with your family. Also, don't invite guests to your house because a healthy person who is in the incubation period, which can last up to 14 days, can spread the virus. As you can see, the most busiest streets of Dubai are empty now because UAE always has its people at heart and has taken the right steps to ensure our safety. I know the tough stay-at-home measure sounds very extreme, but it's better to contain the spread of the virus early. You may have heard about the patient number 31 in South Korea. She is called the super spreader because she had a very mild symptoms for 10 days. Meanwhile, she was attending churches and lunch buffet before she was tested positive. With the domino effect, she is considered to be responsible for over 60% of all the cases in South Korea, just from one person. I don't have to remind you about the frequent hand washing for 20 seconds, like this way. Remember to wash in between your fingers, also the tip of your fingers. Don't forget the thumbs and the little fingers, and also the wrist. This really can save your life. Also avoid touching your face, especially after touching anything, even your mobile phone. So always keep a sanitizer handy with you at all time. It is not a bad idea to sanitize the bottom of your shoes when you arrive home. My final note to you, our invisible enemy is a tiny virus that cannot survive and multiply without a living host. It is dangerous only when it enters our body by reprogramming our cells to reproduce the virus. But outside the body, it can be easily killed with soap or alcohol-based sanitizer. So please follow the necessary precautions to prevent it from entering our body, and hopefully we can beat it. Meanwhile, our thoughts and prayers go out to the people around the world, especially in the US, Italy, and Spain, who have been affected most by this pandemic, as well as to all the hard-working doctors and nurses who are staying at work for you. So please stay at home for us. May God bless you all. I hope you find my topic helpful today. To stay up to date with my latest videos, you can subscribe to my YouTube channel. Until I see you again, I would like to wish you a happy, healthy life.